our reception and waiting room area. The patients are met here with a Honduran church member who's able to welcome them to the surgical center and get their information ready for the surgeries. We have 2 identical exam rooms that are right beside where we can evaluate the patients and see how they are doing. I can take their stitches out here, patient follow-up as well. We do have 1 ultrasound machine that we can use to evaluate the patients if needed, and then also the anesthesiologist can use that to help with nerve blocks if desired. This is my pre-op room and post-operative PACU area. We have been prepping our patients here, starting their IVs and making sure they understand all their processes that are going on. And then after they come out of surgery, they wait here until they're cleared by the anesthesiologist. In this room, we have our crash cart so that our nurses and doctors are able to respond quickly to any emergency situations that may arise. These are the operating rooms that the Lord has blessed us with. We have ample storage space for supplies here in the operating room. We have nice Philips monitors that are able to monitor both the rhythm as well as the SpO2 and the carbon dioxide levels of the patient from inline sampling. Our anesthesia machines are in the room. We have 4 of them, including in the back there a backup machine. We have our anesthesia supplies as well as surgical tables. We have this table as well as a orthopedic table. And then in the operating room here, we also have 2 laparoscopy systems, 1 for each room. These are Stryker systems, and so we've been able to use these to perform laparoscopic cholecystectomies here in the operating room. Across the hall from our PACU, we have a dormitory where patients can stay overnight. We actually only had this happen 3 of our 5 nights of surgery this last time, and so we don't anticipate this very often. But we have enough room in a separate room that's currently been using the storage to segregate men and women so that we can have different dorms for those, with a nurse being able to watch over both of those people. We have, of course, monitors that are able to see the patient and their condition, and then we have a hot shower as well for the patients to be able to clean up if they need to. These are our sterile supply rooms where we keep our OR kits as well as our gowns and drapes and some of our anesthesia supplies. This is our room for instrument processing. We have a dirty area here where we can clean our instruments, and we will have a ultrasonic cleaner on our way down to Honduras right now in shipping crates. And then we have our autoclaves here. We have actually 4 different autoclaves that we're able to do small batches of instruments at a time. Don't yet have a large autoclave system. And then we also have the capability of doing ethylene oxide sterilization as well. In years past, our medical teams would stay downtown in El Progreso at a local hotel. The Rearick was designed so that we can have the team stay on the 2nd floor. This is a great advantage because we're not only limited by the time restraints, but we were also limited previously by the restraints of the staffing at the local hospital. The Rearick is located on the property of Alfaro Baptist Church. We're considered an outreach of the church. We have a nighttime guard, and the gates are locked, so the property is very safe. We have well water, so it's safe to drink, although I still don't push my luck and I drink bottled water. We want everybody to stay healthy on their trip to Central America. Hey, these are our dorm rooms here at the Rearick Surgical Center. Everything's up on the 2nd floor, so it's easy to come up here and relax at the end of the workday, and to be able to rest even in between cases if you need to. And so we have two beds per room. So there's a large area here that you'll be able to stretch out in. We have individual showers with hot water, and so that's definitely a blessing here in Honduras. This is our large common area. We have our kitchen in the background here, as well as our dining room area. We have a meeting area on the other side here, and so we are able to come here in between cases and sort of sit in the air conditioning and just sort of relax and to gather ourselves in between cases. And so we're blessed to have this area here that we can come together as a group. We have laundry at the Rearick, so you can pack less and wash your clothes as needed. We're also slowly having people bring down donated scrubs so that someday you won't even have to pack your own scrubs. Honduras tends to go from dusty to muddy pretty quickly, so we ask that you bring a separate pair of flip-flops or clean shoes to wear inside. I'm also starting a collection of missionary biographies and medical texts, so feel free to bring us your favorite book. Our meals will be a combination of food prepared in our own kitchen, food that's been catered, and our team's going out to eat at our local restaurants. An MMO trip to Honduras isn't complete if you don't go to eat out at Power Chicken, one of our favorite restaurants. If you have any food restrictions, please make sure that they're communicated to Medical Missions Outreach. We'd like to plan a day off so that you can do some sightseeing, and you should have a chance to visit our local grocery store for some snacks or anything else that's needed. And of course, Honduras does have some of the best coffee in the world. I might be a little biased, but it's pretty good. Our goal for the Rearick Surgical Center is to provide ethical medical care and to point others to the great physician. We're doing this by sharing the gospel in El Progreso and the rest of Honduras. I appreciate your partnership as you share your talents with the people that need it in Honduras. Thank you very much. I'm praying that you will be blessed just as you will be a blessing to the people in Honduras.